Sports medicine. Sports medicine. Aims. Sports medicine. Scope. Sports injuries. Sports injuries. Classification. Sports injuries. Causes. Sports injuries. Prevention. First aid. Aims and objectives and management of injuries. Introduction. You must have seen injuries occurring in the playground. Many a times, we see that a person is being treated for injuries in football or cricket playground. A concerned medical team comes and treats the injured person or takes him out of the ground. Do you know who are they? This concerned team belongs to sports medicine. Let us know more about sports medicine in this chapter. Medicine, the concept. Nowadays, sports medicine plays a vital role in improving sports performance of an athlete. Factors responsible for improving an athlete's performance are physical fitness, sports injuries, prevention and treatment, remedial exercises and nutrition. Sports medicine is a branch of medical science which involves many subdisciplines like clinical medicine, athletic medicine, preventive sports medicine, physiology of exercise, therapeutic exercise, etc. The sports medicine team involves many specialists like physicians, surgeons, physical therapists, athletic trainers, coaches, other personnel and the athlete. How to define sports medicine in a single sentence. Different specialists define this stream according to their own understanding. Finally, we conclude that sports medicine is a branch of medical science which deals with the treatment of injuries relating to sports and exercise, including preventive care of athletes. Sports medicine. Aims. Sports medicine has some specific aims that everybody should be aware of. The main aims of sports medicine are to provide information to athletes about injuries, to provide knowledge about the causes of injuries, to provide treatment for sports injuries and rehabilitation, to provide knowledge about the preventive measures of sports injuries. Sports medicine. Scope. We know that sports medicine has many subdisciplines. On the basis of their study, different problems faced by the athletes can be resolved. These subdisciplines come under the scope of sports medicine. Without knowing the scope of sports medicine in depth, it is very difficult to uplift an athlete's performance to its optimum. Let us now identify the extended list of scope of sports medicine. Human anatomy and physiology, sports and first aid, prevention of accidents in sports and games, sports injury rehabilitation, women and sports, study of optimal load for different age groups, scientific promotion of sports and games, fitness for games and sports, athletic nutrition, sickness due to environmental, physiological and psychological disturbance, preventive and curative exercises, physiotherapy, sports and traumatology, new methods of identifying doping, use and abuse of drugs. Injuries. It is quite natural for a player to get injured during practice, training or competition. Coach or physical trainer and sports doctor give their best possible efforts to prevent injuries. One can prevent sports injuries if he or she plays as per rules like use proper protective equipment or maintain proper conditioning. Now let's go to the types of injuries faced by athletes in sports. Sports injuries. Classification. Sports injuries can be classified into soft tissue injuries, bone injuries, joint injuries. Let us know more about each of them. Soft tissue injuries. There are several types of soft tissue injuries like strain, contusion, sprain, abrasion and bruises. Among them, strain and contusion are muscle injuries. Let's get their details. Strain is caused by twisting or pulling a muscle or tendon. It can be mild or severe. It can happen suddenly, example, lifting heavy object in the wrong way, or develop over days or weeks. Contusion happens due to minor accidents to the skin like falling or being hit or kicked. It is common in wrestling, boxing and kabaddi. Stiffness and swelling are common features under this condition. Sprain is a ligament injury. It occurs at ankle or twist joint due to overstretching or tearing of ligament. Swelling, inflammation, severe pain and tenderness are some common symptoms in this injury. Bruises occur to athletes when they bump into some sports equipment. It is not clearly visible as the upper skin remains unaffected, but the inner tissues are damaged. Abrasion is an upper skin injury that occurs due to friction with certain equipment. Mild abrasion is called grazes or scrapes. Bone injuries. It is directly related to the fractures of bones. There are several types of bone injuries listed in sports diary. These are simple fracture, the fracture without any wound where the bone is broken at one place. Compound fracture, here skin and muscles both are damaged along with fracture. Complicated fracture, when bone is broken and it damages internal organs like tissues, nerve or artery. Stick fracture. It occurs when any kind of stress resulting in bent to bones. It is commonly seen in children as their bones are very soft and delicate. Comminuted fracture. Here, bone is broken into many pieces. Impacted fracture. It happens when the end of a fractured bone enters into another bone. Joint injuries. It refers to the dislocation of joint. Dislocation of joint is an injury which forces the bones out of their sockets. It temporarily deforms the joint. It is very common in sports like football, hockey, wrestling, downhole skiing, gymnastics and volleyball. A hard blow to a joint, a fall, lifting, hitting and a forceful throwing can cause this dislocation. Dislocations of joints faced by athletes are: dislocation of lower jaw, occurs when chin strikes any other object forcefully. Dislocation of shoulder joint, occurs due to sudden jerk or a fall on hard surface. The end of the humerus comes out from the socket. Dislocation of hip joint, putting maximum strength rigorously may cause this dislocation. The end of the femur is displaced from the socket. Dislocation of wrist, a miscalculated landing or movement can cause wrist dislocation. Of sports injuries. Let us now identify the major causes behind these sports injuries. Sports injuries may happen due to various causes, such as improper conditioning, improper warming up, unscientific way to training, lack of fitness, nutritional inadequacy, lack of sports facilities, injudicious managing, improper sports equipment, pressure of competition, carelessness during games, overuse of muscles, recurrence of injury, practice during the stage of fatigue, no use of protective equipment. Prevention of sports injuries. The life of an athlete is valuable. Sports injuries have a negative impact on the performance of an athlete. To prevent such injuries, athletes may take some steps like do warming up, stretching and cooling down properly. Do proper conditioning of body through weight and circuit training. Have balanced diet. Acquire proper knowledge of sports skills. Don't do overtraining. Use of protective equipment. Follow unbiased managing. Use proper technique. Obeying the rules. Test yourself. Which of the following is a ligament injury? The options are A. Abrasion, B. Strain, C. Laceration, D. Sprain. Explanation. Sprain is a ligament injury. Occurs at ankle or twist joint due to overstretching or tearing of ligament. Some common symptoms are swelling, inflammation, severe pain and tenderness. Aims and objectives. We can get injured anywhere and anytime. It is impossible to anticipate the time and place of an accident. Many a times, it is very difficult to get medical aid to the victim at the spot of the accident. Some immediate aid is required for the victim, which is known as first aid. First aid is the first treatment or care given to the wounded or sick victim before the arrival of doctor. In the field of sports, any player can be injured during training, practice or competition. In reality, every time it is not possible to provide qualified doctors to the victims. In that case, coaches or physical trainers should have enough knowledge of first aid to provide immediate care to the players. Let's know the major aims and objectives of first aid. First aid helps preserve life, prevent illness or injury from becoming worse, relieve pain and suffering, promote recovery, protect the unconscious, procures early medical aid. So far, we have learnt various types of sports injuries. Now it's time to discuss about their management. Management of sports injuries. Let's start with the management of soft tissue injuries. We have learnt that abrasion is an upper skin injury that happens when skin is scraped or rubbed. It can be managed by doing some remedial actions, such as clean the affected area with fresh water and pick the dead tissue, gravel and debris from that area. Use clean and sterile gauze for drying that area. Apply medical ointment. Visit a doctor for proper dressing and tetanus injection. Dressing to be changed as per doctor's instructions. Contusion is a muscle injury that can be managed by several immediate actions, like immediate use of cold compression. It should be used 5 to 6 times daily, more than 40 minutes continuously. Use anti-inflammatory medicine if swelling is more. Consult doctor if swelling persists in the affected area. Dislocation is an irregular cut in the skin from any sharp object. Bleeding is less in such wounds. Let's see how to manage it. Put pressure directly on the laceration while holding it above the level of heart for 15 minutes. Wash laceration with warm water once bleeding stops. Use antiseptic ointment. Consult doctor if stitches are required. Cover and wrap the laceration with sterile gauze. Give painkiller if required. Look out for infection and change dressing regularly. Incision may also occur due to sharp-edged sports equipment. Blood usually comes out freely from that wound. For that, we should clean the wounds with iodine tincture or spirit. Apply bandage along with a piece of cotton on that wound. Keep the bandage tight if bleeding. Consult doctor if the wound is deep. Is a ligament injury. For the treatment of sprain, 2 procedures, PRICE and MICE, are followed. PRICE stands for protection, rest, ice, compression and elevation. MICE stands for mobilization, ice, compression and elevation. This procedure should be followed once the injury is healed, means signs of inflammation, heat and redness have gone or reduced. Strain is also a muscle injury. Similarly, it has been followed. The same procedures like PRICE and MICE are also followed in sprain injury. Let's check out the management of bone and joint injuries. Start with dislocation of joint. It can be treated or managed by some remedial actions like keep ice on the spot of dislocation to control swelling. Sling or splint the affected joint into its fixed position. Call medical help immediately. Don't try to move the joint or place it back in the socket. Different types of fractures require different kinds of treatment. Let's see what are these. Stress fracture. First, elevate the extremity and rest while the bone heals itself. Apply ice on the affected area for about 24 to 48 hours. Give painkiller if pain persists. Use splint if immobilization required. Use crutches or walking stick once the swelling is reduced and partial weight can be put on the affected area. Avoid activities that can cause stress fracture for about 6 to 8 weeks. Stick fracture. Require immobilization. Recommend removable splint. Provide anti-inflammatory drugs to reduce swellings. Take 8 weeks rest for complete bone healing. Comminuted fracture. Treatment for comminuted fracture is very difficult because of many fragmented pieces of bones. Maintain immobilization with the help of plasters and splints. Give painkiller and antibiotics for avoiding pain and infections. Use physical therapy persistently to treat completely. Fracture. It is a break in one of the bones of the spine or part of it that is shaped like a wing. For that, painkiller should be given. Require operation if the fracture is multiple or intricate. Suggest complete rest. Suggest neck and back braces for reducing pain and increasing mobility. Bone fracture. It occurs when bone is broken diagonally to the axis of the bone. Treatment of this fracture depends upon the amount of damage to the bone. Use a plaster cast. Surgical treatment is required. Use metal rods and screws to hold the bone in place in severe damage. For this kind of fracture, management should be: use splint or sling to hold the fractured bone in right place for healing. Do immobilization. Take more time to heal. Surgery required in severe cases. Test yourself. An injury which forces the bones out of their sockets is called. The options are A. Fracture, B. Dislocation of joint, C. Strain, D. Sprain. Explanation. Dislocation of joint is an injury which forces the bones out of their sockets. A fall, lifting, hitting and a forceful throwing can cause this dislocation. Some common dislocations of joints are dislocation of lower jaw, shoulder joint, hip joint and wrist. Chapter. Sports medicine is a branch of medical science which deals with the treatment of injuries related to sports and exercise, including preventive care of athletes. Sports medicine includes specialty physicians, surgeons, physical therapists, athletic trainers, coaches, other personnel and the athlete. Sports injury is very common for a player during practice, training or competition. It can be classified into soft tissue injuries, bone injuries and joint injuries. Such sports injuries, athletes may take some appropriate steps like balanced diet, proper warming up, conditioning of body, use of protective equipment, proper technique and obeying rules. First aid is the first treatment or care given to the wounded or sick victim before the arrival of doctor. The main aim of first aid is to save the precious life of the victim.